Today at My MediClick, we'll be talking to Dr. Adam Bodian, one of the premier cosmetic dermatologists in the country. He's going to be helping us find out more about non-surgical facial rejuvenation. Now, there's been a lot of advances in these techniques in the last few years. Can you tell us a bit more?
Well, so far it's been great with what we've been able to do. It's really amazing what we can do now without having to take a patient into the operating room. Everything I do in my office is all either local anesthesia, meaning topical anesthesia, so it's really painless procedures. And we can do it getting pretty close to almost a facelift without any surgery.
I guess one of the simplest questions would be, tell us what happens to the face and how it changes as we age.
It's the best way to look at the face is you look at the younger person, it's almost like an upside down pyramid or an upside down triangle. And as you get older in age, that triangle kind of drops and then it becomes a square. And as you see the bones up front that give that nice raise, thin out and the face comes down, that's when they develop, man or woman will develop the folds here, the wrinkles here, start being the 11 lines around here, what they call the crow's feet, lines around the eyes. And that is really what we want to treat.
Fillers have become extremely popular in the last decade. Can you explain to our audience why fillers are so successful?
Yes, recently the fillers have made a tremendous change and improvement from what they used to be 15, 20 years ago. The new fillers are much more natural, stay in the face much more naturally, and last longer, making the patients much happier and making it a much more cost-effective procedure than it used to be.
Now tell us a little bit about Voluma and Restylane Lift.
Okay, so those are some of the newer products. Voluma is the newest of the fillers as far as hyaluronic acids are concerned, and that's basically a hyaluronic acid is what is your body's natural moisturizer. So these are artificial copies of that, and that's why it's able to hide in your body or when you're injected safely without having any health concerns about having these implants in your skin. The beauty of Voluma is that because of the way people make Botox, Allergan, and now make this product called Voluma, but the way they've changed it around is that can stay in the skin much longer, for almost up to 2 years, compared to most of the other fillers that really last only about 1 year.
Tell us how you evaluate people for laser treatment.
It's, the worst thing is when a patient comes in and says, what do I need? And it's not really what I believe somebody needs, it's when you look in the mirror, what do you think you need? Because I can look at somebody and say, listen, you need this, this, and this. And the patient will look at me like, oh my God, I didn't even think about that. I was really worried about the lines between my eyes. So it really is, I tell patients, I give them a mirror and I say, if you had the magic mirror and you could get rid of anything you want that you don't like, show me what you don't want. And then from there, that's my springboard to discuss with the patient the best way to treat them and what would best help them. All right, hi, I'm Dr. Adam Bodian, and this is Jen. Today we're going to be treating her with the Genesis laser. One of my favorite lasers is what's called the XLV laser. What I'm going to be doing is rejuvenating her face, getting rid of some of her redness, tightening the cheeks, and improving a little bit of her acne. So the first thing, I'm going to put some shields for her eyes, because the laser is very bright. Basically what I'm doing with this laser is it's going to heat up the collagen under her skin while also being absorbed by the blood vessels on her cheeks. So we'll get rid of some of the redness, tighten the collagen, and really make a big improvement by heating up her sebaceous glands, which are the glands that make acne, shrinking those glands and basically improving her acne, and eventually we'll get rid of her acne altogether. So we all put on laser protective eyewear. Get the laser started. And that flute means we're ready to go. Just turn a little bit. So basically right now, she feels a little warmth of the skin as the skin heats up. And with this laser, you can never get too hot with it because it's always going to be in a certain area, and I have a little thermometer here, an infrared thermometer that tells me how hot the skin is getting. You can see it really is a painless procedure. Afterwards, there's no downtime. She can go right back to work, go home if she wants, go to the gym. And in a couple days, her friends will be telling her how nice her skin is looking.
So let's talk about brown spots. Brown spots caused by a lot of exposure to the sun or not taking care of your skin. What specifically do you do for brown spots?
Well, there's really two go-to lasers, three lasers, I guess, that you can choose for them. I like to use the lasers because they're more specific for the brown spot. We can use a thing called an intense pulse light. That kind of covers everything, but it's not specific for the brown spots. Again, you can try a YAG laser or a ruby laser, Alexandrite laser. Those are three specific lasers for brown spots that do target just the brown pigment in the skin.
Tell us a little about skin tightening. What type of procedures do you use for that?
Oh, that's again, there's a million different types of lasers we can choose for that. Most used are the fractional lasers that either they call them ablative, where they actually put the holes in the skin, or non-ablative, where they just shoot little holes of heat into the skin to stimulate the collagen within. The ones that don't go through the skin, they take much longer to see the results and much more treatments. That would be a treatment that you'd have to repeat every 4 or 5 weeks to really start seeing improvement. Where the ones that we actually shooting little holes in the skin, the microscopic holes in the skin, that's more once every 6 months a year.
So clearly there's lots of options and there is no one answer, one size fits all for this. So there's lots of doctors out there, lots of options. How should we go about picking a doctor?
Well, if you talk to my mother, everybody's going to tell you to pick me. So that's a no-brainer. But you really want to see someone who has the experience, and you don't want someone who, especially rents their lasers, or says, "Listen, come on Tuesday. That's my laser day," because that's when they have a laser company come in and they bring the lasers. So you want somebody that has experience, somebody that owns their own lasers, and somebody that gives you the options, that they can give you multiple different types of options to treat one problem. And also that somebody's going to tell you, we're going to do A, B, and C. It's not just going to be a filler, but we're going to give you a filler, and then we're going to add to the filler with a laser treatment, with an ultrasound treatment, something to really give you that extra little oomph to the filler to really make the skin look so much better than just a simple one procedure at that one visit.
How much would an average person typically need to take in terms of volume?
The average person, really depends. I mean, the average person could be someone who's 70 years old that will need much more, or someone that's 30 years old that just doesn't want to look like their mother is really what they come in for. So I would say, the average that we do is 1 to 2 syringes. Before we start very conservative, you can always come in and do more. You don't want to end up walking out looking like blown up like a pumpkin or with those big sausage lips. And then everyone says, "Oh my God, what did you do?" I like people that walk out of here where their friends say, "Wow, you look great. Did you change your makeup, change your hair?" That's the look that I'm going for with my patients.
Now you touched on this a bit in some of your earlier answers where you were combining it with laser treatments. So tell our audience what kind of laser treatments are available now.
I mean, there's a book of lasers. There's, for every little thing, there's a different laser to use. But the most popular lasers that are being used would be a laser for either brown spots, get rid of the brown spots in the face. You can use a laser to get rid of any red spots or blood vessels, broken blood vessels. Very popular to tighten any kind of acne scars or wrinkles, fine lines. Then you use one of the fractionated lasers. And then you get into radio frequency or ultrasound therapy, which actually will tighten the collagen and almost give you a little bit of a facelift without any surgery. And again, these are all non-invasive procedures, so there's no needles or no cutting, and it really makes a big improvement on the look of the face.
Tell our audience what your personal philosophy is and kind of how you got into it.
When I was a resident, I just fell in love with lasers. I studied at NYU, and my residency was a very strong cosmetic program. And I learned lasers from Roy Geronimus, and I just fell in love with them. And I knew the second I got out that That's what I wanted to do. And I basically bankrupt my office trying to buy the newest lasers and be on top of everything. But it's just, to me, it's the whole physics and the science behind lasers is just so fascinating, and the way it changes every day. It really is so exciting to look at the science under it and the results that you get from it.
Lasers are cool, guys. I'm Chris Griggs, My Medic Laser.